Hey everybody, welcome to That Expert Show, where you help run the show. I'm Anna Canzano. Thank you so much for joining us for this episode today. We are talking about mental health, especially during this COVID crisis. I don't know about you, but I've been wondering how you're doing, how my friends are doing, how my family is doing, because this is such an unusual, unprecedented time of a global pandemic that we all are struggling with. And even the most mentally healthy person, I'm sure, is affected by this. Like, I have felt at times fine with it, at other times panicking about it. And I have also found myself randomly emotional when I wasn't really expecting to be emotional. Maybe your family is dealing with job loss, income loss in all of this. And, you know, even if you are mentally healthy, but even if you have had a previous diagnosis of anxiety or depression or obsessive-compulsive disorder, this can be particularly challenging and triggering. So I'm really pleased that we've brought on a fantastic partner in this. ZOOM+Care, which is a pioneering healthcare company based right here in the Pacific Northwest, is sponsoring this episode and providing the expert that we are talking to today. He is the Chief Medical Officer of ZOOM+Care. He's dually board certified in family medicine and psychiatry and specializes in designing services for the chronic care of medically and psychiatrically complex people. Joining us to answer our questions is Dr. Erik Vanderlip. Dr. Vanderlip, thanks for taking the time to talk with us today.
Hi, thanks, Anna. Thanks for having me on. And I think this is a really important topic, and I'm really happy to share my thoughts and work together for the audience that you're reaching.
This is such a sensitive topic because I know that, just psychiatric health has a lot of stigma around it. People are reticent to talk about their issues publicly. What are you seeing in the last couple of weeks as this pandemic has really hit home for us?
Yeah. Well, Zoom, I can speak to what we're seeing at Zoom and some of my own personal experience as well. At Zoom, we've had integrated behavioral health care for a while, a number of years, actually. That's what I was hired on to at first at Zoom to create. And we've seen an uptick in demand for behavioral health. I think a lot of people are reaching out for assistance and guidance. They're stressed or they have a worsening of their existing depression or anxiety disorder, kind of as you mentioned. And we can be partners with them as they work through a new kind of environmental stressors in their life. And then on top of that, I think personally, everybody's stressed. I'm here at home. This is my office. I'm lucky enough to have an office at a home. It's safe, and yet it's hard to work and be productive in new, changing environments, even at that. And I think a lot of us have been putting in extra hours, and so there's a lot of that going on too.
Yeah, it really spans the spectrum because, a lot of people don't have the luxury of working from home. I can think of friends in news who, they're working in the type of job where they work out of a newsroom and they have to go to the newsroom to do their work. And it's really stressful for their families. They have to go through a whole protocol of when they come home, they change out of the clothes they went to work in the garage, and they take a shower because they don't want to bring home with them whatever they might have picked up along the way when they were out and about. I would imagine this is particularly challenging, again, for mentally healthy people who happen to be extroverts and are very into the social engagement with family and friends and who rely on that as kind of part of their mental health.
Yeah, absolutely. I think a lot of people who naturally get around others and are used to getting rejuvenated around others are stressed in this time of distancing. We're all turning to FaceTime and Zoom and other platforms to connect with friends. We've had our own hangouts with friends. My daughter's birthday was last week, and she had a virtual birthday party. And I have a screenshot from her friends and us blowing out candles virtually. And on one hand, if you think of it as a glass is half empty type situation, it's sad and disheartening to think that we have to go through, we're in a time where you can't celebrate birthdays together. And on the other hand, you can look at the beauty around us and embrace the fact that so many people are coming together and being creative in a really trying time. And I think by focusing on the latter and really honing into the beauty around us, even in the little things, it can pull us through some of these very difficult times. And I also think, you brought up a really good point, and I didn't even mention our own teams at Zoom who are going in daily to see patients who may have coronavirus. And that's not even mentioning the scores of doctors and nurses, frontline healthcare staff, and support staff that help those operations in hospitals, from our partners at Peace Health to up and down the West Coast and across the country, who are bravely going in knowing that they could be putting their lives at risk. It's extremely anxiety provoking. We have really some unsung heroes around all of us every day.
Yeah, some of the emotions that I have felt in the last week are particularly for the people who are on the front lines in healthcare like that. And I have friends who are surgeons and emergency room nurses, and they have families they're trying to go home to with limited supplies. They're trying to, treat people with uncertainty about the facilities that they have and essentially the weapons they have to fight this situation. What advice can you offer to us, knowing that the tail end of this feels like it keeps stretching out longer? Because we've heard, okay, end of March, beginning of April. Well, now maybe end of April, maybe into May and June. That's a really hard concept to wrap your head around as you're trying to, as humans, look for the horizon, look for the light at the end of the tunnel in this.
Yeah. Well, it won't be forever. And I think a funny thing about public health measures is when they work, it seems like nothing happened. And we're starting to see, I think, the flattening of the curve that we've been talking about for a couple of weeks now. It's working. But unfortunately, that also means that we'll potentially deal with this outbreak longer, because the same proportion of people may get end. They just won't happen as fast. And that's very because it means that the peak of the curve might be delayed by a few more weeks. There's hope on the horizon. A lot of people are working hard to develop vaccines, to develop other measures to treat this and study countermeasures to help people who are infected. And I believe that our attempts to flatten the curve are working. We know pretty well now that in the state of Washington, which was really by and large the epicenter of the initial case in the US, have been successful. Those attempts to social distance have been successful. And that's a good thing. That's something to celebrate. And I think as we come together virtually, we have cause to celebrate those successes, even in spite of the fact that it might mean longer for us to remain apart.
I appreciate that. I think part of my coping in all of this is looking for the silver linings, more time with our families, drawing closer, maybe not dealing with our overscheduled lives that we usually have. I want to take a moment and thank everybody who's joining us live right now on this interview. And I want to thank Carrie, who's writing in saying, I'm having the worst anxiety. How do we get help?
Oh, that's a great question, Carrie. Anxiety is something that is not always a bad response. And I'm a psychiatrist. I work with folks who struggle with anxiety and stress a lot. I would start by saying, listen to your thoughts and your body. Listen to what it's telling you, because it's not always a bad thing. If it's warning you about fears of contagion, you should listen to that and focus on what you can control. There's only so much that you can control in this. washing your hands, paying attention to good hand hygiene, not going out unnecessarily, avoiding close contact with others, and if you develop symptoms of cough or cold, covering your cough, covering your cold, all those basic hand hygiene and other guidance that we've gotten from public health is essential. Those are the things that you can control. And there are some folks who are really struggling with beyond just worry, but worry that really starts to preoccupy their lives, take over their basic functions, and limit their ability to be productive. And that's the point where we would start to, from a medical perspective, draw the line between an anxiety disorder and just a lot of stress and worry. And for persons who are really struggling to stay productive, stay focused, and who can't keep up, there's lots of counselors and other places around and available for you. And you can actually schedule an appointment at Zoom. This isn't a full-on advertisement for Zoom, but you can do that. It's on demand. We have a no wrong door approach to behavioral health at Zoom. So if you schedule a phone or video consultation with one of our daily care providers, they can give you basic guidance and route you around to the right level of care. And in short order, we should have video visits available for those who are truly struggling and provide guidance and advice so you can help sift out what is and isn't a problem and get good ways to kind of solutionize in the midst of this.
I appreciate you defining the difference between just, kind of the everyday normal stress of dealing with what we're dealing with versus anxiety, or when the mental health issues become a bigger problem, when they become essentially a barrier toward becoming productive. Because I think that's the question that might be, turning around in a lot of our heads, is like, well, is what I'm feeling normal? And when is it, when is the barrier crossed that I need to actually go and seek some professional help? I do think that's exciting that Zoom is offering the video teleconferencing, because there is a difference between just talking on the phone with somebody and actually being able to see them and, and watch them as they're maybe offering you some coping strategies.
Yes, I think you really identified a key aspect to this, which is that a lot of it lies in just how functional you are. A person with no worry has no motivation to take care of themselves. Fear is an evolved emotion that we've adapted to over time because it keeps us alive. And in a time like this, we need to lean into that, not let it overpower us, but understand what it's saying and listen to it. But it's different when suddenly it keeps you from unreasonably doing things that you should be doing for your own safety or productivity or to just interact and proceed with your life. And if you're having a difficult time discerning between the two, that's where an expert can really assist you with that.
I want to throw a question at you that's from Elizabeth, who's watching us live as well. It's not so much a question as it is a comment, but I'm sure a lot of us can relate to this. She says it's been hard to explain to her toddler without causing worry in her. I'm a parent as well. We've got little ones, we have a teenager, and we've been doing a lot of checking in with them. It's startling to me when my 5-year-old and 3-year-old both talk about, when we're out on walks, they yell, space, space, because they get the importance of social distancing. Even when we're just on a walk in the neighborhood, my 5-year-old will yell, coronavirus, like she gets it. It's good that she gets it, but I'm also worried about her mentality and how much fear we're setting into her. What is your advice for parents as we talk to our kids about this, knowing that we're talking about kids, everywhere from just preschool and toddler age up to your teenagers, your seniors in high school?
Yeah, I think I'm a parent of 4, and we've had a lot of dinner table discussions around this topic. I think depending on the age of the kid and depending on their sophistication with understanding what's going on, it's important to be honest and transparent. You don't want to hold back details and data, and you need to keep them safe as a parent. That's your number one job. But it's also important to reassure them that they should be safe. There's some basic statistics and facts that should be really reassuring for parents with kids, in that the vast majority of kids are totally fine with this. Even if they become infected, the course in children seems to be a mild course. And that's very reassuring, and that's probably point number one. Point number two is, again, what I was talking about earlier with focusing on the things that you all can control in your household and your family. Setting up fun games and routines for hand washing and hand hygiene when you return from a walk, or covering your cough. We say, like, doing the Dracula maneuver when you kind of go like this and cough into your elbow, and making it a game, having fun with it to the degree possible is good. Leaning into technology, having your kids chat or FaceTime with their friends, setting up those play dates virtually can be fun. And turn a really bleak situation into something different. A lot of families will be worried about loved ones and extended family who are older or vulnerable. And I think it's important to reassure, especially the kids, depending on their level of sophistication and, like I was saying earlier, and kind of development, reassure them that we're doing everything we can to help keep grandma and grandpa safe, and grandma and grandpa are well supported too. I think it's also a really good time to emphasize community service and our ability to partner with others, and support others. And so getting kids involved and checking in on neighbors who may be vulnerable and things like that can go a long way to helping them feel like, and yourself feel like, you're doing something in the community, and go a long way to assuaging your own mental health concerns.
Yeah, that's something that has come up. I struggled this week with, I'm a doer, like I'm a problem solver, and I have felt kind of helpless in this. Like in week 2 or 3 of this, I get it, social distancing, we're all doing our part. That I got down. But beyond that, I'm trying to think like, okay, I have this, small platform from the work that I do. What can I do to help? Should I be, starting a GoFundMe to raise money to buy masks and equipment for the local hospital workers? I've been really kind of struggling with that feeling of helplessness and what I can do to help. And that itself can feel overwhelming.
Yeah. I keep on seeing on social media feeds pop-ups about amazing people who have had, they've donated 60,000 masks to a hospital that they found somewhere. They had a fundraising drive, or they did some amazing things. And I start to think, even for myself, oh no, what am I doing? I should be doing more. And I'm thinking at that level, and I'm missing so many other things I could be doing at my own community level, or even in my neighborhood or my apartment complex, or for my own family. And I think if we each just focused on the domain that we can control, the people right around us, and focused on making a big impact for even a smaller number of people, that's totally fine. And if you think creatively and free your mind up a little bit and get it out of the mindset that I've got to do something huge, like a GoFundMe account for my local hospital or something, I can do something smaller. If each of us did that, we could really do a lot for our neighbors in need.
I appreciate that. I just have to share this because it's pretty funny. Beth is saying and watching live, she says her whole family is getting fat from her stress cooking. So I guess that's how she's being productive in all of this, is making a lot of meals, a lot of yummy meals for her family.
There you go. That's service right there. I mean, that's right.
There's a question that came in on Facebook that I wanted to make sure I asked. I thought it was interesting too. Michael on Facebook wants to know, is this a good time to be attempting any sort of lifestyle change, like giving up caffeine or losing weight?
Could be. I think it kind of depends. Anytime we talk about lifestyle change in medicine, we look to things that are going to stick. You want to do new activities, forgive the pun, but bite off things that you can chew and stick to down the road. And so this might be a time, because you're relatively restricted from being able to get caffeine, that you kind of break the caffeine habit and get yourself through the withdrawals of going without caffeine. But you're going to want to build it into a new kind of routine. And arguably, this time isn't the time to necessarily establish new routines forever. Or is it? I don't know. It's kind of up to you and your ability to establish those routines. If you find that the artificial restrictions on our movements and other things are limiting your exposure to alcohol, cigarettes, caffeine, other things, and this would be a useful time, yeah, go for it. But the key will be really locking in that behavior down the road.
Let's talk about that a little bit because you mentioned alcohol, and I'm going to assume here, and correct me if I'm wrong, but alcoholism, domestic violence, the type of behaviors that are unhealthy will go up during this time.
Yeah, I think we could hypothesize that. There's certainly more loneliness, more isolation, and more stress going around. And yet at the same time, there's also more people leaning into each other. And we will have to keep a close eye on a lot of those things as they emerge over the coming weeks and months.
Can we talk too about, I know we discussed anxiety and how crippling that can be. Can we break down some of the other major diagnoses? Like, can we talk about depression? What are the signs of depression? And again, when should you seek help?
Yeah, thank you. I think that's a great question. Probably amongst U.S., the population in the United States, depression, major depressive disorder is the single most common psychiatric illness. And the symptoms, as you can imagine, are overwhelming sadness, but also feeling incredibly, what I like to think of as being burned out or flat, what we technically call anhedonia, and that's lack of pleasure. You have to have one of those two things for more days than not in a 2-week period to technically be diagnosed with a major depressive episode. In addition to those, you can't just have those. You also have to have a constellation of other symptoms, which may include poor appetite, difficulty concentrating, poor sleep, low energy. Let's see, what else am I forgetting? Feeling so slow or agitated, loss of interest in things, and overwhelming guilt, feeling worthlessness, and thoughts of suicide. Any of those, or a constellation of all that together in a 2-week period, would be what we'd call a major depressive episode. There's a great score that you can do online. It's called the PHQ-9. If you just Google that, you can see and score it yourself. There's even apps you can download that gives you a basic gestalt across those symptoms for how you're feeling. And if your score is 10 or greater, it's suggestive of moderate symptoms. And in those instances, most adults would, or most people, we'd recommend seek medical guidance to look into what's going on and see if they're really struggling with depression.
I appreciate that. The third one I wanted to ask you about was obsessive-compulsive disorder, which, traditionally would be excessively, actually, I'm not even going to try to define it. I'm going to let you define it and talk about how this COVID situation can aggravate people with OCD.
Yeah, so obsessive compulsive disorder is defined, like the word suggests, by obsessive thoughts and then compulsions to act on those thoughts. And it needs to be a consistent pattern. And oftentimes the obsessive thoughts are experienced by the person to be out of normal reaction to the world around them. They often come in patterns, and one of the common patterns that is worrisome in the coronavirus pandemic is fears of contagion. And a lot of people will unrealistically worry about exposure to germs, and that will compel them to wash their hands repeatedly, often to the point of extending more than an hour in those activities daily. And there's a lot of folks who have that and struggle with that now, who I think are understandably struggling more. And those are the types of folks that we're happy to give guidance and advice to. There's lots of pathways to manage that, including formal cognitive behavioral therapy that can be delivered via the interwebs. And also medication management can be helpful at times too. And sometimes folks who already have obsessive compulsive disorder, who may be struggling more, can look back into their treating facility or treatment provider to see if they can get adjustments in their medications, or have a few more cognitive behavioral therapy sessions to get brushed up on their coping mechanisms and skills to help them manage those obsessions and compulsions.
We will, just so everybody knows, we will be creating a tip sheet, as we always do, for each interview that we do, summarizing the episode, providing links to the resources that we mentioned. It's just an easy place to kind of read through and even share that information with others. We'll post that shortly after this episode. One other comment that came in from an Expert Show insider. This person says, Mom's still living, 61, in reasonable health. She's so scared for her. She can't lose her. Dropped off a bag for her yesterday, sprayed it with Lysol after dropping it on the porch. This person actually is still working, 2.5 days at work, the rest from home. She works in-home as a house manager for a stroke survivor who requires 24-hour care. All caps, I'm freaking out. I have 2 N95 masks I've had for about 3 years. I wear one when I'm out. I sanitize it and reuse it. I have a sterilization room in the garage bathroom at work. I've put in all the precautions. Again, all caps. I can't stop worrying. I want to do more. I feel the pull to do more in my community. If this were your client, what would you say to that person?
Yeah, I would start by going into the details of what's preoccupying their mind and going through the thoughts and how the thoughts, I'd correlate that to how the thoughts are leading to function or dysfunction. It might sound bad. Fear and worry is not a pleasant sensation. But if the behaviors as a consequence of that are functional, if it's helping to protect your loved ones to a degree, if you're able to reasonably get some sleep and stay abreast of the things that you need to be taken care of, then I'd say I would acknowledge that though it might be extremely unpleasant, and I would acknowledge the fear and anxiety that you're undergoing, I don't know the degree to which it would be considered a disorder necessarily. That's speaking with my medical hat on. In my non-medical hat, I'd say, oh, I hear you. I think we're all in the same bucket. Everybody is worried about what's happening with this and how we can protect our loved ones. And I'd want to offer a lot of empathy and compassion for your state. I too about your loved ones. And I appreciate the steps that you're taking to help keep them safe.
You mentioned sleep, and that brings to mind conversations I've had with people that I know who have struggled to get sleep in the last several weeks. Some of them do have family members or who are themselves healthcare workers. Do you want to talk about insomnia and some strategies, some coping strategies when it comes to, bouts of inability to sleep during this time?
Yeah. So absolutely. Insomnia is one of the things that we deal with the most, and mental health. And sometimes, like I mentioned before with depression, even anxiety disorders, it can be a component of a bigger issue. And in those instances, we'd want to try and actively manage the bigger issue, like major depressive disorder or generalized anxiety disorder. Straight up insomnia that's not related to some bigger issue, we'd parse apart. We'd dig into it and we'd say, what's leading to this? And I would hypothesize most folks right now just have a lot on mind, fear, worry about the world around us, as well as our loved ones, like we mentioned earlier. And so if your mind, as you're trying to go to bed, is jumping on the hamster wheel of fear and worry at night, there's lots of solutions for that. The best, I think, are to acknowledge that nobody can go to sleep when they're afraid or scared. And the more you lay in bed and toss and turn, the more you're going to get frustrated by laying in bed and tossing and turning. And the lizard brain part of our brains are going to start to associate going to bed with being frustrated. And so the thing that you've got to do is kind of divorce or disassociate the bedtime thing with the worry thing. And the way you do that is literally break them apart and don't do them together. So get up. You're going to be up anyway. Go somewhere else to a different location, even sit at your dining room table, or if you're in a one-bedroom apartment, sit at your little kitchen table. And what you've got to do is get those thoughts out of your brain and onto something else, like a piece of paper or a journal, or pick something that you can change right then and there because you're going to be up anyway, and change it. And if you can't, set up a time the following day to change it then. Focus on the things that you can control. And then most of the time you'll find that that will help. And that will help alleviate some of the burden because now you've got a plan for it. And it may not be a perfect plan, but time for that plan. And then you can rest and get back to sleep. And there's a lot of other tips and tricks. Sleepy time tea, warm milk, melatonin, a lot of over-the-counter remedies can be very helpful in these kinds of times. And taking care of your day-to-day hygiene, getting out, getting exercise, wearing yourself out, not doing screen time, all the basics that we say for getting to sleep at night, you can't throw out the window just because it's a pandemic.
I really like that idea of separating the two behaviors. Like, this is sleep time and some other part of the day is going to have to be worried time. Did you say the lizard part of the brain? Did I hear you right?
Yeah. Yeah, there's parts of our brain that they work on operant conditioning, behavioral conditioning. It's the kind of stuff that there's an old Russian scientist, psychologist who did a study of dogs, Pavlov and his dogs, and he rang a bell and showed them a steak, and the dogs started salivating. We have reptilian parts of our brain that automatically associate things in our environment with stimuli. And what we want to do is try and avoid coupling bedtime with worry time, because your lizard brain will put those two together. And the more you lay in bed and toss and turn and stare at the clock, the more that's going to happen.
That's going to be my takeaway from this interview. All I'm going to think about is that lizard brain. One last question for you, and this is from an expert show insider, who wants to know, is it a good idea to speak openly about the mental health barriers and issues that they face and experience with family and friends, and specifically newer friends right now? This person feels the need to put it out there when they start developing a friendship, mainly so the other party knows what they're getting into in case they want to bail. But they're just wondering, is this a negative thing to do when it comes to mental health, because potentially it becomes their defining characteristic?
That's a great question. I'm going to answer your question with a question. Would you tell them if you had rheumatoid arthritis? Would you tell them if you had asthma? Or would you tell them if you had cancer? And I don't have an exact answer for that because I don't know the exact dynamics of a new relationship and your comfort level with disclosing those things. But I will say what we cannot do is let mental health stigma be more mental health stigma. And I think in the world that we're at, our fear of disclosing behavioral health only makes it more palpable for others, or it almost excuses others for stigmatizing behavioral health conditions too. In the end, what I want for every individual is to have ownership over their own illness or their own disorder or whatever they want to call it, their own symptoms, and decide for themselves what's best and when they want to tell friends, family, or new friends. This decision is hard for anybody with an illness that is not easily seen. And there's a lot of illnesses out there that aren't easily seen. Behavioral health is something that many people suffer from that is not easily seen. So that decision is a very personal decision based on the dynamics of the new friendship. But what we can't do is let fear of behavioral health stigma somehow let us treat it or think of it differently than asthma or rheumatoid arthritis or anything else. And that's what I would encourage everybody to strongly consider, fully acknowledging that the world may not see it that way, and external providers outside or external people outside of us may choose to put stigma on us for behavioral health, and that's on them. But your decision to disclose shouldn't be based on your own internal stigma for behavioral health.
That's intriguing and wise advice. I'm going to close with a comment from Rosina, who's joining us on Facebook, who says that she wishes that her job could set them all up to work remotely. She says it's scary to go to work daily when she's not really considered an essential worker in reality. She says her company's still working to get them laptops, but supervisors have been working from home since day one. That is the reality for, I think we started the show talking about that. It's kind of a luxury to be able to work from home, and it's a luxury that not very many, that some people just don't have right now. What would be your advice to Rosina?
I'd work with your employer to make sure that they are making all the accommodations they can to keep you safe and protected and abide by the state and the government and the public health guidelines around social distancing. Employers right now are also, I think, I'm not trying to defend them, but in a really difficult position, we're all kind of facing something that we've never had to face before. And I know for a fact that a number of small businesses are struggling to keep the lights on and keep people employed. We're hitting record unemployment rates. And so there's a balance in all of these things. In the end, at ZOOM+Care, I can speak for what we're doing, which is that we are doing our best to keep our employees as safe as possible and also continue to keep the lights on for people so that they don't need to make unnecessary emergency room visits or hospital visits for things that we can help them with. And we are trying to balance that desire to try and help the community with keeping all of our people safe. And so we have had the luxury of being able to work from home, but there are some members of our workforce who can't because they work in our pharmacy or lab or for our help team and don't have the luxury of home internet connections and others. And so we've practiced social distancing for those. We've made hand hygiene and other things at the workplace pretty regular and routine. Your employer should be doing all of those things to try and make as many accommodations as possible to keep you safe.
Before we go, Dr. Vanderlip, I just wanted to mention ZOOM+Care had a pretty substantial development just this week or the latter part of last week. You have a mobile test site now set up in Seattle?
Yeah, I can briefly describe it. We actually entered into a very innovative pilot program where we're trying to validate salivary samples or the ability to detect coronavirus in saliva compared to the typical test that you do in your nose. And the way the typical test works is you have to have a fancy swab. This is not a swab, this is a pen. But you have to have a fancy swab that's very long, and you have to stick it all the way back in somebody's nose. And in order to do that, a healthcare provider really has to do it, and we have to get all gowned up and expend masks and gowns, gloves, face shields in order to do that and protect us while we're doing that nasal sample. There's not very many swabs. There's not very many gowns. There's not very many masks. And so we are looking at a way to detect coronavirus in the saliva so that people can give us their own saliva sample. And we had a limited number of testing opportunities available up in Seattle. And we're still evaluating the results of that pilot. And we're hopeful that it will work. We've partnered with Molecular Testing Laboratories, which is based out of Vancouver, Washington. And I really credit them and another consultant with helping us design this pilot and think through all the logistics of it. They've been great partners.
Very good stuff. Dr. Vanderlip, thanks so much for taking the time to talk with us today. And I'm sure this will be helpful to a lot of people.
Thanks, Anna. It's been a real pleasure being with you this afternoon. I hope so.
And thank you for joining me for this episode of That Expert Show. You can always go back and watch previous episodes or review this one on our website, thatexpertshow.com. You can subscribe to our YouTube channel, That Expert Show, or you can take in this content as a podcast if that's easier for you. We're on Apple, iTunes, Google Play, Stitcher, TuneIn, Spotify, all those good places. You know, my primary method of communication with you is via social media. Please reach out to me. Tell me what topics, what guests you want me to cover. I'm on Facebook, Twitter, and Instagram. Just look for Anna Canzano. I love the conversation with you. I love the feedback I get from you and the ideas that I get from you. That's the whole reason I started this show, was because I wanted this to be a conversation between you and me and to be helpful in some way to your life. So please subscribe if you can. Leave us a review wherever you're seeing this. That helps others find us. And until next time, join us again for That Expert Show, where you help run the show.